spraying. I never use it in here because it's a mess. All right, it gets on the gums up the table, gums up the floor, things of that nature. So I don't use it. But if you're gonna get into taping, you would. Now, the bottom of your foot generally doesn't have hair on it. Okay, all right. If you do, I mean, all right, you're Sasquatch or something. But that being said, we really don't have to worry about changing the feet. Now, the problem with the feet are what?
Sweaty.
Sweaty. All right, that's why tape spray it works so much better. All right, and we're gonna put this on. Some of you guys are gonna have sweaty feet. Okay, that's where your most sweat glands are. They're in your hands and they're in your feet. So I mean that's an area. Luckily with our hands, we don't cover them. We don't wear gloves all the time and stuff like that, so we don't get stinky. But with your feet, obviously you guys have pulled off your socks sometimes, and they probably don't smell the best, especially after playing a game or something. All right, now the first one's so easy. We just take some type of pad. All right, so I just cut out a piece of Spanko here. All right, to put in where the arch is. All right, the only problem is sometimes holding that first one on. All right, but just recreate an arch for the person. Start around the metatarsal edges. Okay, with this one I'm going to use 1.5 inch, but you can use 1 inch. 1 and 1.5 kind of get used interchangeably on the foot a lot. Depends on how big their feet are. Just overlap each one. All right, and we're kind of recreating an arch. Put 3 or 4 depending on how big their foot is. All right, and we just made an arch for them basically. I put a little pad in there, kind of brings up their arch. Now, people with arch problems could be a lot of different things. Who's got one right now? Peyton Manning, what's he got?
An excuse.
Plantar fasciitis. All right, and maybe it's an excuse, maybe, but if he does have plantar fasciitis, you guys probably never had it yet. All right, if you ever get it, it's like you get out of bed the first thing in the morning, you put your foot down, and it's like a sharp jolting pain going through your body. It's actually quite painful. All right, then if you put that person, he's got to throw the ball. So when he throws the ball, he's got to pivot, push off, plant, and there's all that pressure on it. I'm sure it does hurt, okay? So, granted, I don't know how bad his plantar fasciitis is, but I do think he does have a problem because it looks like he can't throw the ball that well right now. All right, so anyways, that one is really easy. You're probably not going to be asked to do that one on the test, but it's probably the one I show you that you're not going to be, okay? But I want you to practice it because this is the one we use probably a really easy one to use on someone that's having some arch pain. All right, and it's simple, all right, and we use it a lot. So now, when you take tape off, all right, just don't grab it and rip, okay? All right, now granted, at least I don't have tape spray on. If you did have tape spray, sometimes you might have to pull skin from tape, okay, as opposed to tape from skin. So that's important. Now, with this, I didn't use tape spray, and generally the feet are sweaty, and in this class, I'm sure it's not gonna be a problem pulling it off. But just be careful, just don't start ripping tape. Sometimes you pull a piece of skin with it. And then, some people, are allergic to certain types of tape. Obviously you guys probably won't know until we start putting it on. But generally this tape's hypoallergenic. It's a decent tape. You're not gonna have a problem with it, okay? But if you do, all right, so be it. We might have to tape over your sock, something like that. All right, now, the next one, which one's next up there?